Happy December, new month. You know what that means. It is time to study for the CHT exam. Congratulations to those of you who just got your test results and found out that you passed. If you took the test, even if you didn't pass, serious congratulations. It is such hard work. Take a little bit of a break, give yourself some downtime, give yourself grace, and get ready to go again because I know that you can succeed. I believe in you. But let's go ahead and do 15 practice questions for the month of December for the CHT exam. We'll go through all of the questions, pick your answers, make sure you commit to them, and then we will go back through the answers, give you the correct answer and the rationale behind it. Let's go ahead and get into it. Tendon rupture of the extensor digitorum of the fourth and fifth digits at the ulnar styloid is A. Von Jackson syndrome, B. Mannerfelt-Norman syndrome, C. Bunnell-Littler syndrome, or D. Preiser's lesion. Question 2. What position of the wrist allows for maximum joint surface contact of the distal radio-ulnar joint? A. End range pronation, B. End range flexion, C. Neutral forearm rotation, D. End range supination. Question 3. In application of electrotherapy, the therapist is setting the time period that the current is on, or the interval between the beginning and end phases of pulse. They are adjusting the A. Pulse amplitude, B. Pulse width, C. Pulse rate, D. Pulse frequency. Question 4. Which of the following describes cryoglobulinemia? A. Cyanosis, pallor, redness, following exposure to cold. B. Tissue ischemia due to an abnormal blood protein turning into a gel. C. A histamine response that causes hives as a localized response to cold. Or D. Anemia due to hemoglobin being released from damaged red blood cells. Question 5. Which method of energy transfer is the direct transfer of energy without a medium? A. Conduction, B. Radiation, C. Evaporation, D. Convection. Question 6. Which of the following orthoses would be most appropriate when treating a patient who presents 2 weeks after a non-operative Bennett's fracture? A. Thumb spica orthosis with the IP joint free, B. Forearm-based ulnar gutter with the MCP joints positioned in flexion, C. Wrist cock-up orthosis with the wrist positioned in 20 to 30 degrees wrist extension, or D. Resting hand orthosis in the safe position. 7. Kienbock's disease is associated with A. Avascular necrosis of the scaphoid, B. Negative ulnar variance, C. Positive ulnar variance, D. Hook of hamate fractures. Question 8. A therapist has been working with a patient who sustained a distal radius fracture treated by ORIF 6 weeks ago. The patient reports that in the past week they are having difficulty sleeping due to pain and numbness of the thumb, index, and middle fingertips. The pain improves during the day. Which of the following complications is most likely the cause of this? A. Long-term edema, B. Median nerve compression, C. Carpal instability, or D. EPL tendon rupture. Question 9. A child has sustained a wrist fracture which is classified as Salter 3. Which of the following structures is affected? A. Physis, B. Physis plus part of metaphysis, C. Physis, metaphysis, and epiphysis, or D. Epiphysis. Question 10. If following the modified Kleinert protocol for flexor tendon rehabilitation, when would the therapist initiate removing the orthosis for wrist motion and initiate gentle active flexion? A. Postoperative week 0 to 4, B. Postoperative week 3 to 6, C. Postoperative week 6 to 8, or D. Postoperative week 8 to 10. Question 11. When fabricating an orthosis for a patient after flexor tendon repair, how would the therapist position the patient if following the short arc motion, SAM, protocol? A. Synergistic orthosis with a hinge allowing full wrist flexion. B. Dorsal blocking orthosis with the MCP joints in 50 degrees flexion and the IP joints in extension with elastic traction. C. Wrist cock-up orthosis combined with a yoke orthosis. D. Dorsal blocking orthosis with the wrist positioned in 20 to 30 degrees wrist extension. Question 12. A patient presents with handlebars palsy. Which of the following structures is involved? A. Hook of hamate fracture. B. Ulnar nerve at Guillaume's canal. C. Median nerve. Or D. Ulnar nerve at the cubital tunnel. Question 13. An infant is being assessed in the clinic after a brachial plexus birth injury, resulting in Erb's palsy. How would the child's affected limb likely present? A. Elbow extension, shoulder external rotation, wrist and finger extension. B. Shoulder external rotation, elbow flexion, wrist and finger flexion. C. Shoulder internal rotation, wrist and finger extension, and elbow extension. Or D. Elbow extension, shoulder internal rotation, wrist and finger flexion. 14. A 13-year-old boy presents with a diagnosis of Little League elbow, and the referring physician has recommended conservative management. Which of the following would likely be an appropriate component of an early treatment plan for this patient? A. Activity modification principles, including avoiding positions that require supination as well as avoiding overhead activity. B. Prescribed rest and range of motion exercises in the sagittal plane. C. Performing core exercises with a medicine ball reaching overhead. Or D. The Throwers 10 program and practicing throwing for 1 hour every day. Question 15. Which of the following ligaments contribute to elbow stability against valgus stress? A. Lateral collateral ligament. B. Annular ligament. C. Radial collateral ligament. Or D. Medial collateral ligament. Right, congrats everybody, you made it through all 15 questions. Go ahead and take a moment, pause the video if you need to, look back at your answers, make sure you feel committed, and let's go back through the questions with the correct answer or the best possible answer of the options, and then the rationale. Question 1, correct answer is A. The answer for B, Vanderveld-Norman, is being unable to flex the IP joint of the thumb after spontaneous rupture of the FPL. Bunell-Littler is a test that evaluates the source of PIP flexion motion limitation by differentiating between intrinsic muscle or capsular tightness. And then a Prizer's lesion is the idiopathic avascular necrosis of the scaphoid. Correct answer is C, neutral forearm rotation. This is plain and simple, pure anatomy question, so that would be something to go back and review when looking at the DRUJ. And 3, correct answer is B. The pulse amplitude is the intensity. The rate and the frequency are the same. They're both the number of pulses per second. 4, correct answer is B. These are all important to know in terms of PAM's use of cold and a contraindication or precaution. The description in A would describe Raynaud's phenomenon, C describes cold urticaria, and D describes paroxysmal cold hemoglobinuria. Some hard to pronounce words. Question 5, correct answer is B. Conduction would be heat transfer with direct contact between objects. Evaporation is changing from a liquid to a gas. And convection is movement of a fluid carrying heat. 6, the best answer here is A. A Bennett's fracture is a thumb fracture. It's an intra-articular fracture and dislocation at the first metacarpal base. Sorry, I can't talk today. So the A is really the only option that makes sense to immobilize the thumb. And 7, correct answer is B. Negative ulnar variance because it's avascular necrosis of the lunate, which can lead to negative ulnar variance over time. 8, correct answer here is B, median nerve compression. The real tip-offs here are the nocturnal paresthesias and pain and the numbness in the median nerve distribution is also a good hint. Correct answer is A. The rest of the options, so B describes a Salter 2, C would be a Salter 4, and D is going to be the Salter 5, which is a premature closure of the growth plate. And correct answer is B. The modified Kleinert is an immediate controlled passive motion protocol in which 0 to 4 weeks would be active IP extension against rubber bands. Week 6 to 8, you start some differential tendon gliding, and generally week 6 to 8, you may be beginning gentle resistance as well. 11, correct answer is B. The concept is that of MAMTT, which is minimal active muscle tendon tension. So you're going to want a dorsal blocking in 20 to 30 degrees of wrist extension, and then MCP joints 50 degrees of flexion, and IP joints in extension with elastic traction. 12, correct answer is B. The ulnar nerve at Guillaume's canal is actually pretty common with biking and holding a handlebar. 13, correct answer is D. Erb's palsy will position in a waiter's tip nerve position because it is C5 to C6. A Klumpke's palsy will imitate an ulnar nerve lesion because it is affecting C8 to T1. 14, correct answer is B. Activity modification would be good, but we want to avoid pronation. Core exercises are good, but trying to avoid overhead loading, and then it's probably a little too early at this time frame to start the throwers 10 and also returning to that throwing protocol. Question 15, correct answer here is D. The lateral collateral ligament is going to help against varus stress. The annular ligament stabilizes against rotation, and the radial collateral again restrains against varus stress. To do it, thank you so much for watching. If you made it this far, good job. You are the true MVP of this video. If you made it this far, comment CHT on the comments below. And I will see you in the next one.